All right, welcome back to our Achilles Tendinopathy series. This is phase 3 recovery. In this phase, we're just running through a few extra exercises that you can start incorporating into your regime. So by now, you've done 6 to 8 weeks of like the eccentric exercises, the heel drop Alfredson protocol. And you're not getting much pain. You may even be able to tolerate some light running without any aggravation of pain, which is fantastic. You're making progress. Now I want to start rebuilding a little bit more elasticity in those tendons. So in the clinic, in terms of acupuncture and treatment, we're keeping it pretty much the same, but we're probably going to start spacing things out a little bit more. You're feeling a lot better, so you don't need to see us as frequently, but we're going to continue to use those points to stimulate repair and healing of the tendon. Outside the clinic, you're going to keep up with your Alfredson protocol heel drops. So keeping up with those daily, you're going to start incorporating up to 3 times a week some of these jumping exercises. So I'm going to run through the variations of the jumping exercises, but essentially you start with jumping with 2 feet with these various exercises, and you can progress to doing single-legged jumps. I would recommend kind of like balancing out each side as well, because otherwise you're going to have one massive cuff if you just focus all of your rehab on the affected side. So also another thing is, depending on like what exercise or sport that you're getting back into, you're probably going to start incorporating some more specific drills to sort of get you back into that, but that really depends on what you're doing. You might be working with a coach or something if you've got like specific like sport that you're retraining for. Really important before we get into the exercises is tendons take time to repair. So even though you're feeling a lot better, and even though you're close to being able to go back to normal sport, your tendon will continue to remodel for like up to a year or longer. So it will be still a weak spot that you will have to take care of. You just won't have to focus as much time as you are in these initial phases, but it is important that that you maintain that in the months to come. So just a little heads up for that. Anyway, I'll cut to the videos. All right, so phase 3 exercise is to incorporate some jumping exercise into your heel drops that you're already doing. So you're going to be doing these jumping exercises about 3 times a week, because you want to make sure that you've got recovery in between each time that you're doing it. And as always, use pain as your guide. So if this aggravates your pain during or within 24 hours after you did too much, so do less next time, or give yourself more recovery in between. You don't want to be setting yourself back. So the exercises are, you're going to start with 2 feet. So the first exercise is just jumping on the spot. So just like this, and you're going to do that 60 times. The next one is you're going to start jumping side to side. So side to side. And you're just going to do that 10 times. So side to side is 1, 2, 3, so on and so forth. And then last variation is jumping forwards and back. So forwards and backwards. And again, 10 times. So you're going to do all of those up to 3 sets. So I would suggest just starting with 1 set 3 times a week. And then if the following week, or even like if that was just too easy, you can add in another set and work up to 3 sets. Don't put everything in straight away, because you might irritate it. You can if you're finding the double jumps are getting too easy, you can progress to single leg. So just doing the exact same things, but with 1 leg, and so on and so forth. All right, hope that helps.